11 signs of an unhealthy fetus. Who does not want to protect their child while in the womb? I mean, of course, everyone. Hi friends, I am Kritilin and you are watching Nutro Plus. Today we will talk about the 10 signs of an unhealthy fetus. What precautions should you take if you are pregnant to protect your child? Before we proceed, subscribe to our YouTube channel for more amazing content. This video is for educational purposes only and should not be considered as a diagnosis or treatment plan for any individual's situation. So let's start. To eliminate any threat to your baby, it is important to be able to differentiate signs of a healthy fetus from an unhealthy one. If left unattended, it might lead to a miscarriage. Miscarriage is one of the common consequences of an unhealthy baby, resulting in loss of pregnancy before the 20th week. Today, we will cover some of the warning signs in this video. During the 5th month, a fetus becomes more reactive towards sound, light, and pain. This is a period when they are also exposed to various threats that may affect growth and development directly or indirectly. If problems are visible externally, corrective measures can be taken to deal with them. But how do you recognize an unhealthy fetus inside your womb? The answer is simple. You just need to watch out for these warning signs. Number 1. Abnormal fundal height. Abnormal fundal height helps the doctor evaluate whether a woman's uterus is growing or not. To measure fundal height, you will be asked to lie down and using a tape measure. The length from the top of the uterus to the pubic bone is measured. Usually, after the 16-week mark, fundal height matches the progress of the pregnancy. If the height of your uterus is not what it should be, it indicates a problem with your pregnancy. The reason may be too much or too less of amniotic fluid or a breech baby. In the worst case scenario, it could also mean that the fetus is not developing in a proper manner. Excess cramping during pregnancy. Pregnancy comes with its share of pain and aches. However, extreme pain which feels like menstrual cramps is another warning sign in early pregnancy. It may be caused due to poor blood flow, but if it persists, you might need to consult your doctor. Bleeding during pregnancy. Women tend to experience spotting during pregnancy, which is quite normal. However, bleeding is still a matter of concern. Without a doubt and needs to be evaluated by a doctor, it might be a sign of miscarriage, hormonal bleeding, or implantation bleeding. Extreme back pain. Experiencing back pain is common during pregnancy as the growing baby puts a lot of strain on the spine and lower back. This feeling worsens when you are expecting multiples. Well, look out for back pain which becomes severe as opposed to a dull ache in the back. Also, if it starts from the front of your body and makes its way to the back, it's not a good sign. You should visit your doctor immediately. Vaginal discharge during pregnancy. Vaginal discharge is a common condition experienced by women when they are pregnant, and it increases as the pregnancy progresses. Usually, the vaginal discharge of a pregnant woman is clear, transparent, whitish, and odorless. However, if you notice the yellowish or greenish discharge with a strong smell, then it's time to consult your doctor without any further delay. The unusual discharge might be caused by cervical inflammation, indicating a sign of miscarriage. Sudden discontinuations of morning sickness. Morning sickness and pregnancy are correlated. Usually, morning sickness resolves itself by the end of the first trimester or even earlier without affecting the fetus. However, for some pregnant women, sudden discontinuation of morning sickness might be because of low HCG levels, pointing to a miscarriage. It is advised to seek an expert's opinion and make sure there is no threat to your baby. Fever during pregnancy. Fever during pregnancy should not be ignored. A fever might pose the threat of a bacterial or viral infection to the fetus. It can result from various factors such as infections, colds, flu, or other illnesses. Elevated body temperature may pose risks to the developing baby, especially during the first trimester. Pregnant women should seek medical attention if they experience a fever to receive proper evaluation and appropriate treatment to safeguard their health and that of their unborn child. contraction of breast size. During pregnancy, the body of a woman goes through a multitude of hormonal changes. Breasts go through a transformation and become more sensitive. They also feel heavier and fuller as the pregnancy progresses. However, a sudden decrease in the size of breasts may signal a miscarriage. No fetal movement. Fetal movement can be felt around the 18-week mark as the fetus starts reacting to sound, light, and pain. Experts say that a pregnant woman should experience around 10 kicks every 2 hours during this. If the fetus is in distress and the count declines, it is a clear sign to consult your doctor for proper treatment. Any delay in seeking medical help might cause an unfortunate event. Sudden spike in blood sugar levels. It is normal for blood sugar and blood pressure levels to rise during pregnancy. In fact, you should keep these levels throughout 3 trimesters. However, a sudden and high spike in blood sugar levels can lead to pre-eclampsia and may induce preterm labor. Proper management is crucial to avoid complications for both the mother and the baby. Regular prenatal checkups help ensure a healthy pregnancy. Abnormal heartbeat. An abnormal heartbeat during pregnancy, known as fetal arrhythmia, can be a cause for concern. It can manifest as an irregular, fast, or slow heartbeat detected during routine prenatal checkups or ultrasound examinations. While some fetal arrhythmias are harmless and may resolve on their own, others may require monitoring and medical intervention. Causes can include structural heart defects, maternal health issues, or disruptions in the electrical signals regulating the heartbeat. A fetal echocardiogram may be performed to assess the heart's structure and function. Timely diagnosis and management are crucial to ensure the best possible outcome for both the baby and the expectant mother. Close communication with healthcare providers is vital to address any concerns and follow the recommended course of action. Precautions for pregnant women, ensuring the safety of the fetus. Pregnancy is a crucial time in a woman's life, and taking necessary precautions is essential to ensure the well-being and safety of both the mother and the developing fetus. Here are 10 important precautions that pregnant women should follow. Regular prenatal checkups. Regular prenatal checkups with an obstetrician or midwife are vital for monitoring the health and development of the fetus. These visits help detect any potential issues early on and allow for timely interventions. Balanced diet. Maintaining a balanced and nutritious diet is crucial for the proper growth and development of the fetus. Pregnant women should consume a variety of fruits, vegetables, whole grains, and proteins while avoiding harmful substances like alcohol, caffeine, and unpasteurized foods. Hydration. Staying well hydrated is important during pregnancy to support the body's increased blood volume and provide a suitable environment for the baby to develop. Safe exercise. Regular low-impact exercise is beneficial for pregnant women, but they should avoid strenuous activities or sports with a risk of falling or injury. Consultation with a healthcare provider about suitable exercises is recommended. Adequate rest. Pregnant women should prioritize getting enough sleep and rest to support their own health and promote the growth of the fetus. Avoiding harmful substances. Smoking, illicit drugs, and exposure to harmful chemicals or toxins should be strictly avoided during pregnancy, as they can have severe negative effects on the fetus. Managing stress. High levels of stress can impact both the mother and the baby. Engaging in relaxation techniques such as meditation, prenatal yoga, or seeking support from loved ones can help manage stress. Proper medication use. Always consult a healthcare professional before taking any medication during pregnancy. Certain medications, including over-the-counter drugs, may not be safe for the fetus. Prenatal vitamins. Taking prenatal vitamins, including folic acid, helps prevent neural tube defects in the developing baby. Avoiding harmful environmental exposures. Pregnant women should avoid exposure to environmental hazards such as radiation, lead, and certain pesticides which can harm the fetus. In conclusion, following these precautions can significantly contribute to the safety and well-being of both the pregnant woman and her developing fetus. Regular medical checkups, a healthy lifestyle, and a supportive environment are essential elements in ensuring a successful and healthy pregnancy journey. Always consult with a qualified healthcare professional for personalized guidance and care throughout this important phase of life. So that's it for today, folks. I hope you found this information helpful. Stay tuned to Nutro Plus to follow a healthy lifestyle. I will see you in the next video. Till then, goodbye.